Hello, I'm Tamara Brock, and I'm in partnership development at Black Health Matters. Welcome to our talk on colorectal cancer in the Black community. The recent passing at age 43 of actor Chadwick Boseman, best known for his superhero role of the Black Panther, came as a shock to so many. But did you know that colorectal cancer disproportionately affects the Black community, where we have the highest rate of any racial group in the US? Yet screening can prevent colorectal cancer by finding and removing growths, otherwise known as polyps, before they have a chance to become cancer. Please help me welcome GI oncologist at Memorial Sloan Kettering, Dr. Fiyinfolu Balogun, as he leads us on a conversation about the signs, symptoms, risk factors, and treatment options for colorectal cancer. Dr. Balogun.
Thank you very much, Tamara. Hello, everyone. Nice to meet you all and nice to see you all. And to have this opportunity to talk to you about colorectal cancer and how it affects, in particular, the Black community. Let me share my screen for you. All right. So colorectal cancer, the title of my topic today, I'll be talking about confronting colorectal cancer in the Black community. I'm one of the GI oncology doctors at Memorial Sloan Kettering. I focus on cancers that affect the digestive tract. And today's talk will be, I have no disclosures first. And then today's talk, the way we'll proceed is we'll start, which makes sense, to start talking exactly what is colorectal cancer. And I will mention how this is affecting young adults. And I'll emphasize how colorectal cancer affects the Black community. And we'll go a little bit into steps we can take to prevent colorectal cancer and also the diagnosis and treatment. We'll touch on that too. So one step back, what exactly is the colorectum? We say it, we throw it around. It's really just, it's in the name. It covers both the colon and the rectum. And these two organs are part of the digestive system. So the colon is the large bowel, and the rectum is the part that connects this large bowel, which we see here, to the anus. So the large bowel is the colon, and the rectum is pretty much at the end of the colon, but it acts a little differently. We do, however, treat them similarly, pretty close, with few differences when we talk about cancer. The main functions of this part of the digestive system is to absorb water and some nutrients, and then also facilitate, as you can imagine, since it connects to the anus, removal of waste from the body. Colorectal cancer is a very common cancer. It's the third most common cancer in the US in males and females, and it's the second biggest cause of cancer deaths in the US. These numbers also mirror what we see across the whole world. So it's something that's pretty significant. We see estimates here where we talk about the numbers in terms of when you look at men and women, it's the third most common. When you look at men and women separately, it's also the third most common cause of death. But when you combine these numbers, because men don't have breasts and women don't have prostates, the colorectal actually becomes number 2 in terms of the cause of death. So it's something that's very significant. So one interesting thing about colorectal cancer is that it is preventable. And what makes it preventable is that we can see it before it becomes cancer. Now, that's not a benefit we have for most other cancers. The ability to be able to see something before it becomes a cancer and take it out. So that way you're preventing it before it even becomes a problem. And this is what we call growths or polyps. Now, here you see a figure. When you go from left to right, it's a polyp. It's a small little growth. It's not a cancer. As it grows bigger and changes, evolves, it eventually becomes a cancer at this end. Now, if we can catch it before it gets into this cancer stage, then we can actually even take it out before and never have cancer. And that's the advantage of, that's one thing what we can do in colorectal cancer to prevent it. Unfortunately, as Ms. Tamara said, Ms. Brock said, colorectal cancer, we're starting to see it happen. We're seeing it more common in young adults. The one example, unfortunately, that we all know about is Chadwick Boseman, Black Panther. And we define colorectal cancer in terms of the young onset as when someone has cancer at the age younger than 50. Over the last couple of decades, over the last 20 years, the overall rates of colorectal cancer, especially in the average, the older population, has actually been going down. So we're seeing it, we're doing a better job there. But unfortunately, it's seeing the difference, they're seeing the reverse when we look at younger individuals, so people less than 50. In the last 2 decades, in the last 20 years, that amount has actually increased by more than 50%. And we make sure that we look to examine whether this is due to us screening more or finding things that we didn't find before, but that's not the case, just the absolute numbers. Now you wonder, why is this happening? And honestly, we don't know for sure yet, but we're learning more and we're trying to figure it out. 2 things that we look at is genetics versus environment. When I use the word environment here, in this case, and when we use it a lot in cancer, we're not talking about the sun, the stars, and the moon. We're talking about anything that's not part of you, anything you experience in this world. So the place you live, access to grocery stores, access to hospitals, food you eat, those are all environment, things that are just not coming from inside you, but are affecting you from the outside. So is that what's causing an increase in colorectal cancer in the young population? Or is it the genetics that's changing, our internal makeup? That's what our genetics is, our DNA, our blueprint. So the question is being investigated to find out and understand why. And when you think of young people, there's a unique, this is a unique group when you compare to the older age that have more, historically been having more colorectal cancer. In the younger group, they're still building their families. They still have young children. They have elderly parents that are dependent on them. Fertility is something that matters. They're usually still working. So a lot of institutions and organizations are now starting to hone in and focus on the needs of these groups. So one example that I'm involved with is the Center for Young Onset Colorectal and GI Cancers at Memorial Sloan Kettering. This was set up, one of the first center in the country that was set up that focuses on this group of young people and addressing their needs. Now, when you come to how colorectal cancer, what we're seeing about it in Black people, I've painted a picture for you that lets you know that colorectal cancer is very common, and it's both in terms of diagnosis and in terms of mortality, so people dying from it. When you hone in more specifically on Black people, it gets even worse. So colorectal cancer rates are the 2nd highest among Black people in the US when you look at all racial and ethnic groups. When you look at Black people compared to white people, colorectal cancer, they're 20% more likely to have colorectal cancer if you're Black, and you're 40% more likely to die from it. Over 20,000 people are Black people in the US are expected to be estimated to be diagnosed with colorectal cancer this year, and about 1/3 of them are expected to die, or a number, not 1/3 of this exactly. So this is something that's actually pretty prominent. And also when you look at the young population, the young onset people, the proportion of colorectal cancer is highest among Blacks, and this is expected to continue, is expected to increase. So we need to do something about this. A figure to paint this picture a little more about what has happened over the decades. The light gray line represents white people in the US, and then the maroon line represents Black people. When you look at men and women, males and females, back in the 70s, we saw colorectal cancer less in Black people and Black men, and about the same when you look at Black women versus Black men versus white women. Over the years, yes, it's improved for everybody. You remember I said that in the older population, it's starting to go down. We've seen increases, but it has flipped. And now it's just been worse for Black people versus white people. And that trend has continued to maintain. So things that cause this, some of them we all know about. A lot of it is environment. So much more environment than we can think of in terms of genetics. So access to high quality screening and treatment. And that includes access to hospitals and cancer centers, access to screening modalities that help us catch this colorectal cancer before it becomes a cancer, and also some change in risk factors. And now risk factors, it's something that you may be wondering, what's that? Risk factors are essentially things that can increase your chances of developing cancer. So identifying what these risk factors are can help you reduce your chances of having having colorectal cancer, cancers in general, but colorectal cancer specifically. We look at risk factors as modifiable or non-modifiable. And what that means essentially is modifiable, we can modify it, we can change it. Non-modifiable, there's nothing we can really do about that risk factor. But knowing these risk factors can help us reduce our chances, because those that are modifiable, we can reduce them. So if your diet is high in red and processed meats, you can reduce that and reduce your chances of colorectal cancer. Obesity and waist size, not being physically active, being more sedentary, which unfortunately, as a whole for everybody, that has gotten worse in the pandemic with work from home. It's good, has its pluses, but there's some downsides too, unfortunately. Tobacco, alcohol, those are things that we can change. We can affect them, and by changing them, we change our chances, our risk factors, and our chances of getting colorectal cancer. Some things we can't change. Age is one of them. The older you get, the higher the chances you have of colorectal cancer. I'm not Benjamin Button. There's nothing I'm going to do to reverse my age. Every day passes, I get older. Family history, that's a very important one we'll need to spend a little bit more time on. And other diseases that one may have, like inflammatory bowel diseases. You can try to control them as best as you can, but if you have that, you can't just make it disappear. Family history, it refers to the inherited risk. So if colorectal cancer runs in your family, then that means there's likely a higher chance that you can have colorectal cancer. We don't pick our family, so we don't pick whatever risk factors that run in them, but those are things that we should, those are non-modifiable risk factors. A bit more about this family history. If someone has a family member, what we call a first degree family member. So if it's someone who is related to you, one removed, just once removed from you, which essentially is your parents, your siblings, brother or sister, or your child. If any of them has colorectal cancer, it does increase your risk of having colorectal cancer. If that family member was diagnosed at the age of less than 50, so falling into the young onset group, it increases the risk of colorectal cancer. If you have multiple relatives, if the number of relatives is higher than one, or it increases, the more they are, the higher the chances. And what all this tells us is, although we cannot control our family, we cannot determine what family we're born into, knowing this information can actually help us further control and reduce our risk of colorectal cancer. I'll circle back to that when I talk about screening, but it's very important to know your family history. We don't like to talk, people don't talk details or much about how their health is, the diseases, the specifics, but these are things we need to know. Grandma, grandpa, great grandma, aunt, everyone, what people had. 1 in 3 people who develop colorectal cancer have been found to have a family member who had it. So it's something that if you know your family member has colorectal cancer, it can help you. Another thing is tying with the risk factor of obesity and lack of physical activity. The more physical activity you do, just by itself, that reduces your risk of colorectal cancer. Now, when you're talking about physical activity, you don't have to be running marathons. It'd be good to run one, but you don't have to. But think of it as 150 minutes. So that's 2.5 hours of moderate intensity exercise. Now, every week. Now, what's moderate intensity exercise? It's one example, common example is walking, or walking fast. Now, this is walking at a pace where you're not strolling. It's not a leisure stroll, but you walk fast, whereby you're not fully out of breath, but you know your heart is going faster. So you can still be on the phone talking. That's moderate intensity. If you do that 30 minutes a day, 5 days a week, you're good. You're checking that box. You're really filling out that cup. If you do it 1 hour a day for two times a week, you're pretty much almost there, even if you don't have time every day. So those are things you can do, examples of how this is actually within reach. In addition to reducing the risk of colorectal cancer, this can help also reduce the risk of heart disease, diabetes, stroke, and so many things. Another important modifiable risk factor is the diet. A diet, that's what you eat. If it's rich in fruits, vegetables, that helps you, not just in terms of, it helps you with your heart and diabetes and your overall health and high blood pressure, but it also helps you reduce the risk of colorectal cancer. When you think of this healthy diet, the way I like to describe it is when I look at my plate, half of it has vegetables and fruits, a quarter has carbohydrates, and a quarter has proteins. So when you think of your proteins, try to make them as healthy as possible. So avoid, you don't have to cut out red meat fully, but limit it. Processed meat, if you can avoid it, but you can also just cut it, just limit it. Things like proteins like fish, poultry, eggs, cheese, those are recommended. And when you think of your carbohydrates, whole grains, so whether it's wheat bread or oats, I love oatmeal. Oats are great. Whole wheat pasta. So things that we normally buy in the grocery store every day, we'll see the regular pasta and the whole wheat pasta. Till I started actively thinking about this, I used to ignore the whole wheat one, and suddenly, slowly over time, I was able to switch most of my diet really to include these kind of better whole grain protein, carbohydrates. Now, screening is a very important thing, and that's really the most important message. If you're going to take one message away from here, is that you should get screened for colorectal cancer. Remember that this is a cancer that we can tell what it is before it becomes cancer. We can identify it, and we can take it out and stop it from being cancer. The earlier you can do this, the earlier you can determine it and find it, the more chances you have of treatment, and the less likely you are to have any, the less likely you are to have disease that is incurable. So screening essentially is looking to find if it's there early, and then to prevent the colorectal cancer from actually happening. Who should be screened? Recently, the average risk person, if you have, when we say average risk, no family history of cancer, colorectal cancer, no genetic syndrome that you know of, nothing in your genes that you've been told can increase your risk, or any medical conditions like the inflammatory bowel disease, ulcerative colitis, Crohn's. Those people who don't have anything like that, at the age of 45, you start your screening. It used to be 50, but recently was reduced to 45. Now, if you have a family history, you may need to start earlier than 45. This is why, even though you cannot change your family history, it's not modifiable. If you have that information, you can actually use it to reduce your risk of having colorectal cancer. Screening typically goes up until age 75, and your doctor can help guide you to determine whether you need to get screened longer. If you're having screening of note is for when there are no symptoms. If you're having any symptoms, if you're having blood in your stool, if you're having change in your bowel habits, you should see your doctor regardless of age, because screening is when there are no symptoms. We want to catch it before the symptoms even show. Screening options, the one that's the gold standard that we all know, where most of us hear about, is the colonoscopy. And that's one big advantage of that is they go in there and take a look with the camera. You can both see the polyp and take it out at the same time. However, it is not very convenient for a lot of people, and it also can be costly. Over time, there have been other screening options that have become very good and actually recommended to along with colonoscopy. Some of the more common, some I like are the stool-based ones. You can do this in the privacy of your home. Essentially, you just have your stool tested. You get a packet, which I'll show you on the next slide. Put your stool on it and drop it off in the mailbox. This you do every year, once a year. Some other ones include using a CAT scan or a sigmoidoscopy. Those are less commonly used, especially in the US. The stool test, one of the more common ones is the FIT test, Fecal Immunochemical test. And this one looks for blood in the stool because the cancer, if it's there, or the polyps can send blood, can release a little bit of blood, they tend to, into the stool. And this kit can catch it. You do it at home, privacy, and you put it in a mailing envelope. The whole packet comes in together with a return envelope in there. And when it's sent back, the result comes in about 1 to 2 weeks, and your doctor will be in touch with you, because if it is positive, then you need to do a colonoscopy to actually take a look. But this is very convenient. It's much more easier to do. You don't have to take time off work, and it's affordable too, and it's just more accessible. So we've been really trying to emphasize and encourage people to do this. Now, as mentioned just on the last slide, if the test comes back positive, then you'd have to do a colonoscopy, because that actually looks to find out where this blood is coming from to confirm whether there's a polyp and can take it out. Some of the symptoms that one can have if they have colorectal cancer: your bowel habits can change. Maybe your stool becomes thinner, or you're having more, you're going to the bathroom more frequently, or you're having a hard time going for a long time. There's blood in your stool, that's always something that should be evaluated. Pain in the abdomen and the belly. Weight loss when you're not trying to lose weight, or you're feeling weak and tired, or you're having loss of appetite. Any of these signs, just go to your doctor immediately. This is not a time for screening, it's a time to get evaluated. And make sure you persist until you get the attention that's necessary, because that's a problem I see sometimes, where people go and complain about symptoms, but they may not be taken seriously, and then they let it go. But make sure you get a satisfactory answer. I'll touch really quickly on what happens when someone has colorectal cancer. The colonoscopy is one of the key ways we diagnose it. We also use blood work, and we use a CAT scan to take a look at the whole body to see if it's spread anywhere. We stage it from stage 0 to stage 4. The higher the stage, the more advanced the cancer is. When it gets to stage 4, that means it has left the colorectal area and has spread to distant organs. And that does affect how we treat it. We can treat it based on surgery. We can use chemotherapy, immunotherapy, which are pretty much just drugs that you take. Think of it like any pill or any injection you take. Or we can use radiation, which is I describe as a laser that we use to treat it. Now, one last brief mention, that's a little pivot from what we're talking about with colorectal cancer, is pancreas disease, because I also take care of pancreatic cancer. Like we see in colorectal cancer, with pancreas disease, there's a disproportionate effect on Black and African Americans. The National Pancreas Foundation, we're coming together to form a Black and African American initiative where we're targeting specifically Black and African American people to educate them more and provide resources and research regarding pancreatic disease, including pancreatic cancer. There is a guide that was a very nice looking guide. This is just the front page here that gives us a lot of information and education about this. The NPF, National Pancreas Foundation, is also at the Black Health Summit, so you can get more information at their booth. Thank you all for your attention. If you have any questions, I will go into the, you can write them in, and I'll go into the chat box now to see if there are any questions, or you can raise your hands too. Thank you for your attention. We also have, the Memorial Sloan Kettering also has a virtual booth in which you can get more information and more resources about colorectal cancer, how it affects the Black community specifically, and also the effect and resources for younger individuals. It was a great opportunity. I'm honored to have this opportunity to discuss colorectal cancer in the Black community to everyone. Please feel free to reach out to us. We do have the booth and we have resources at the MSK Memorial Sloan Kettering Cancer Center virtual booth, which will be available for the next 90 days. And really, if you can also get on the website and reach out to us. You can call my office. If you have any, if there are any way that we can be of help, or I can be of help. As I said, the one thing, if you're going to take away from this, is screening. Get screened. Well, two things. One, know your family history, and two, get screened. But nice to have this opportunity to talk to you all.